Welcome everyone to the POPS Study Updates webinar. Today we'll be talking about the post-operatory pain study that's being implemented in the National Dental PBRN. If you are not a member yet of the network, please join us using the QR code that you see on the screen. Today we'll be joined by Dr. Walji, Dr. Tungare, and Dr. Law. Dr. Walji is interested in investigating how informatic approaches can solve clinical problems and improve the quality and safety of oral health care. He serves as a professor in the UT Health Houston, both in the School of Biomedical Informatics and in the School of Dentistry. He is the principal investigator of the POP study. Together with Dr. Walji, we have Dr. Tungare. She is a dentist and public health professional interested in integrating public health and health informatics research methods to advance oral health care research. She serves as a Postdoctoral Research Fellow at the UT Health Houston School of Dentistry. And in her role in the POP study, she develops and implements qualitative and quantitative data analysis methods for analyzing the data that's collected for this study. Dr. Law is a practitioner and a researcher of endodontics with over 25 years of service. Dr. Law has a multi-specialty clinic in the Twin Cities in Minnesota, the dental specialist. He also teaches continuing education courses, does clinical research, publish scientific and clinical research papers, and he's a research professor in the Division of Endodontics at the University of Minnesota, and he's past president of the American Association of Endodontics and American Board of Endodontics. But most importantly, Dr. Law is a practitioner who is doing the POP study. He completed this study and he will be sharing his experience doing this study with us. Now we go with Dr. Walji.
Great, thank you. Thank you so much, Dr. Cruz. And I wanted to also thank the National Dental PBRN for giving us an opportunity to talk about the POP study, which stands for Post-Operative Pain Study, and to give you a quick update. Next slide, please. So the POP study has a few goals, but just as a reminder, the study uses a mobile health platform called Follow-Up Care, which we use to text patients a short survey about their pain experience and the medications that they're using and if they have any challenges. We collect that data to answer some of the questions that we have here, but we also feed that data back to the practitioners as well to see how that system can actually help manage the post-operative pain period. So the goals of this study are really to collect data, these patient-reported outcomes from the patients, and assess the post-operative pain experience for a whole host of common dental procedures that occur over a 21-day period. Our second goal is to assess the types of pain management strategies that are being used by the patients and that have been prescribed by the practitioners. And these could be prescriptions, they could be over the counter, or they could even be non-medication alternatives as well. And then lastly, we're really interested in the use of the application itself. So we're interested in looking at the acceptance of the mobile health platform and to see if it's something that may be of use in everyday practice. So we're hoping, we'll generate some good insight from this observational study, both on the post-operative pain management and experience of the patients, as well as the willingness to use a platform like this from both the provider and patient perspective. Next slide. So just a quick reminder of where we are. We're really about midway through the study, and we started this study a couple of years ago, and we've progressed very well. If we can go to the next animation there. So we're right here in October, November, and we're hoping to actually complete recruitment of the study by May of 2024. And my colleague, Dr. Tungare, will give you a quick update on that in a second. Next slide. So in terms of the number of practitioners, we're very excited to report that we have reached our target goal of 150 practitioners. Our first practitioner was recruited, I think, at the end of 2021, beginning of 22, as part of our ramp up phase. And just as of a couple of months ago, we have recruited our 151st practitioner. So that's been great news, and you can kind of see the steady increase that we've had. We have a nice distribution in terms of gender, and most of our practitioners are general practitioners, and they work full-time as well. So next, just a quick update in terms of the number of participants that we're recruiting. Our target is just over 3,100 patients, and we've made really great progress. We're at 82% of our participants have been recruited. And I want to just say thank you to all of the practitioners who are out there, who have completed this study or who are midway in recruitment, who are just beginning. You've just done an amazing job over the last 18 months or so in recruiting all of these patients. As I mentioned before, the platform that we're using texts patients on various days. And you can see on the right-hand side here, the different days where we text the patient. And you can see the response rate that we have. As you can see, we have very good response rate. On the day of treatment, when you recruit the patient in your chair, they complete that demographic information. And then we text them the day after, 3 days, 5 days, etc. And you see that we have a relatively high response rate. It does decline a little bit over time, as we would expect as well. So the patients also are doing a great job as well. And then here's just some quick snapshot of the demographic distribution of our patients as well. So we've got a pretty nice split between male and female. And we have a nice range of ages as well, where the majority of the age group is between 46 and 65. And then you can see the race and ethnicity breakdown there on the right as well. So, we are interested in collecting this information. And so we'll be able to use this as part of the data analysis as well. Next slide. Okay, great. So now I'm going to turn it over to Dr. Tungare, who's going to give you a little bit of a glimpse of some of the results that we have so far.
Thank you, Dr. Walji. Thanks so much. So next, we are going to look at all the patient responses that we have received so far until September 30th this year. And we are going to see how are we going to use these responses, what are the associations that we are trying to study. And then we are also looking at so far, what is the distribution of our procedure, the medications that the patients have reported to have taken, and so on. So in this study, this is the main hypothesis that we are trying to understand. We want to study the variations of post-operative dental pain experience in patients based on the different dental procedures that they undergo. So in terms of the post-operative dental pain experience, it could be the patient's pain intensity in terms of pain scores, such as, on a scale of 0 to 10, what's the pain that they're feeling on day 1, 3, 5, 7 up until day 21. And then it could also mean how pain interferes with their daily life, how it affects their ability to sleep or to walk or to speak. So these are the things that we will be looking at when we look at the patient's post-operative dental pain experience. And then under dental procedures, we will be looking at endodontic, periodontal, and oral surgical procedures that are, associated with a significant amount of post-operative dental pain. So this is the causal pathway that we are trying to study here. And we, along with studying how dental procedure affects this pain experience, we are also going to take into account these different factors that are known to affect the patient's pain post-operatively. So we do know that preoperative dental pain does affect post-operative pain experience. We also know that the medications that the patient is taking will affect the pain that they feel on each of the days. And then, of course, the time that has elapsed since the procedure plays a big role. So these are the three factors that we are going to consider in all of our analyses. Along with these, we are going to consider different patient factors as well. So we are going to look at patients' age, gender, say for example, do males experience lesser or greater pain than females? Is this statistically significant? Look at patients' race, ethnicity, their effects, and then the effects of socioeconomic variables. So patients' education level or insurance status or the number of members that they have in their household. Do these things affect their post-operative pain experience? So along with these different factors, then we also look at these different factors that are clinical and complication related. So non-medicine pain relief methods could be used by patients in combination with medications or independently. We want to understand how they play a role. And then those patients who also experience bleeding or swelling complications after the procedure, how does that affect their pain experience? So this is the causal model that we are trying to study here. And I want you to remember this when we talk about in our last slide on the results that we are trying to see. These are the things that we will consider in that. So moving on, as of now, we have a total of 2,201 participants from whose responses we were complete and we were able to analyze for this purpose. From those, we see that a majority of them are extractions. They could be simple extractions, surgical extractions. So these are the two major procedure categories that our patients have undergone in this study, followed by non-surgical endodontic procedures. Think non-surgical root canal treatments, epexifications, retreatments, those kinds. And then it is followed by surgical implant procedures. So between these three procedure categories, they make up 82% of all procedures that we are seeing in our study so far. Looking at the medications that patients have, told us that they have consumed to manage their pain. On day one, we see that a majority of our patients are taking non-opioid pain medications to manage their pain. And on day 3, this number does go down by a lot. And by day 5, there is almost an equal amount of patients who are either taking a non-opioid pain medication or no medication. And then on day 7, the patients who take no medication go on increasing, but we do see there is still a good amount of patients who are taking some kind of medication on day 7 as well. So in general, just through these crude numbers, what do we actually see? We can tell that the number of patients who consume non-opioid pain medications goes on decreasing as we progress through day 1 to 7. The number of patients who do not take any medications goes on increasing from day 1 to 7. But what we also see here is those patients who report to have taken an antibiotic or other medication, these gray bars here, kind of go on increasing from day 1 to 5 and are almost similar up until day 7. And these are the interesting things that we find out when we try to visualize these responses, and we wonder why would that be happening. In terms of non-medicine methods, we are seeing that 42% patients also reported consuming or using non-medicine methods. Think ice packs or application of heat, those kinds of things. And then complication-wise, 35% reported to experience bleeding and 68% experienced swelling post-operatively on at least one of these days up until day 7. So then when you look at these numbers and you look at these trends, we are trying to understand, okay, would the patient having swelling or infection post-operatively be the reason why these antibiotics are prescribed later in the study period? So these are just kind of things that we are trying to understand and correlate when we are trying to visualize these data points in an interim or a preliminary phase. And then this is the end goal of our study. So what we hope that we can find out eventually is how pain trajectories are for each of the dental procedure categories. So for example, over here, there are only 4 procedure categories. We'll have many more, but just to give you an idea, this is from an unadjusted analysis. So these are all averages. These are all numbers or pain scores on a scale of 0 to 10, where a patient reported on day 1, X amount of pain. We added those up, divided by the number of participants, and we have these crude average numbers or mean scores. So these tell us how pain varies from day 1 to 7 for each of these categories. And in general, we can see that there are similar trajectories with a decrease in pain levels from day 1 to 7 for all 4 of these procedure categories. We also see that maybe from day 5 to 7 for surgical implants, it doesn't go down as much. It kind of remains maybe similar, but for every other procedure category, it does go down. What else can we see? We can see when was the first day when the average pain experienced was less than 1. We see that for simple extractions, it's on day 7 versus it's day 5 for non-surgical endodontic or surgical implant procedures. Then we try to ask questions like, can we predict recovery times through these? And these are the things that we're trying to understand and find out. But most importantly, I want you to remember that these are all unadjusted pain levels. We will next add all of those factors that I had mentioned in the very first slide to the statistical model, and then try to have a visualization like this, where we are able to show, when we consider all of these factors, this is how pain changes by procedure category. So in summary, we do see that a majority of our procedures are non-surgical endo, simple and surgical extraction procedures. Pain medication consumption and pain intensity goes on decreasing as we progress from day 1 to 7. And again, these are just interim findings. This is from a limited data set, just a partial data set. It includes just raw numbers, proportions, and averages. So the next step would be to conduct statistical analyses, including all those patient and clinical factors in our models, to understand how pain intensity and interference change with our procedure categories. And finally, we are through with our 82% recruitment. Thanks to all of you for your support. We just need 500 more participants. So we look forward to your support. And thank you again. And on to you.
Thank you, Dr. Tungare. This is amazing that we are able to see some preliminary results from this study, and that recruitment has been so good so far. Congratulations to the whole team. We would love to hear now from Dr. Law about the implications of study implementation in dental practice. And we have some questions for you, Dr. Law. And if you are attending this webinar and have some questions, please use the Q&A box to ask your questions, because we will have more time to answer those questions in a few minutes. You can also raise your hands, and you can be on camera or using your talking to us to ask your question instead of typing on the Q&A. The first question for Dr. Law is, what's the impact of patient recruitment and participation on routine dental practice? We know that sometimes practitioners are concerned about what's the impact, will that influence my workflow? And in the network, we try to keep these studies very simple so that this is not affected that much. So Dr. Law, share with us what you think and how it was the impact in your practice.
I should have previously participated in some other national dental practice-based research network studies, so we were familiar with the flow of the informed consent process. I should also mention that I told my team whatever compensation I received for the study, I would split between my team members. So they were highly motivated to have the least amount of impact on our dental practice. If you think about a typical patient, they're coming in, they're going to be, we'll be gathering some data for them, and we'll be getting information even before I come in the room. So that's a great time to start the recruitment process, and it's not delaying any of my examination and any other procedures. And then there's time when the patient's getting numb, when they can be doing some additional enrollment procedures with the study. So it's really minimal impact on the dental practice from my perspective. And again, the team was highly motivated to engage the patients, to enroll, as well as encourage them to participate in the entire study process.
Do you have any suggestion on how to engage patients to ensure that they respond to the questions and increase the response rate on that part of the study after they leave your office?
Yes, and I think that's an important part of this study, not only to engage in the study, but also to complete all the questionnaires. As you saw in the previous slide, I believe it was around 68% or somewhere about that range completed all of the questions in the study, and we'd love to have that be a lot higher. So first of all, I tell them that this is really important research. We want to understand how frequently patients have pain after treatment, and then what we can do to more effectively manage that pain. So it's interesting for them, but it's also, if they think about the impact on other patients, it's motivating for many people to know that they're helping other people to have a better experience. So, and I say that it's great that they enroll, but we really need to have the entire process completed for that to be most meaningful for the data analysis and for future patients if they're going to be having these procedures.
Did you get any feedback from patients or your staff from participating in this study?
You know, we had a couple patients who were older and they were challenged with the technology. We were able to work through most of those questions, but in a later slide, you'll see that some of the patients didn't fill out all the time points, and we found out later from one or two of the patients that they had difficulty with the application or the platform, and we were able to talk through that so that some of them became engaged again and started answering the questions. But that was I would say, one of the bigger challenges, and that was still rather minimal. My patient population tends to be a little bit older, and in spite of the fact that some had struggles, most of them did not have any problems with the platform.
And it's interesting that this platform, the Follow app, the dentist can track the patients in the background, right? And can also message and receive the alerts when patients pass a threshold of pain. Can you tell us a little bit about that? How was your experience with that, Dr. Law?
You know, for me, it was interesting. We have a call service and I'm on call 24 hours a day. Patients seem to be more comfortable using this application or this platform than calling in. I think they see it as an inconvenience to call in for the practitioner. I'm not always available to take the phone call, but I might be available to respond to a quick question on the application. And the response may be, I will call you, or I'll have one of my team members call you. So it can be more efficient, and I suspect we'll get more engagement with the patients because they might be more comfortable just texting a response rather than calling in.
And what are we looking here? Are the practitioners' reports?
Yes, and this is, if you look on the right-hand side of the screen, this is what I found really interesting. You can see for all the patients that my team and I enrolled in the study, we had good participation. By the way, these are almost consecutive patients. Almost every patient we approached was able to participate in the study. If they didn't participate, typically it was because they were going to be out of town or something. They were worried about cell phone coverage. And we did this in the summer months of Minnesota. A lot of people go to their cabins, and some of them didn't feel like they'd be able to get cell phone service. So for the early part of the study, but you can see we had good participation. What's interesting is the patterns. You can see that a surgical endodontic surgery, about a third of the way down, very little pain. And I think patients expect to have a lot of pain. So that is typically what I see. It was nice to have that confirmed. I would have liked to have more surgical patients, but most of my treatments are non-surgical. And you can see that we do a pretty good job with root canal treatment, alleviating pain. You can see the pain levels from 0 all the way up to 10, but by day 1, the highest pain level was a 5, which I would consider moderate pain, about a third of the way from the bottom. And only one patient was having significant pain at day 21, which was the patient had a pain level of 4, and there were other issues going on with that patient, meaning they had other dental treatment that needed to be done and some TMD issues, which we find are fairly common in patients that have non-surgical root canal treatment. So this is really valuable information. And the fact that I got this report back and I can relate this to my experience and relay this information to other patients about what they can expect in the post-operative period was really interesting. You can also see in the lower left that we had a fairly high response rate by day. So although there were 68% that had reported at the later time periods, we were at 90% that were reporting. And I think that has to do with how you engage the patients in the beginning. Tell them it's really important to get all of the data and not just the first week after the treatment, and why it's important. Because we want to be able to track the pain for longer periods of time and find out who is more likely to have some more persistent type pain versus the pain in the first few days. And then you can see some other demographic data that I received in the upper portion, partially covered by the practitioner participation report.
This is great information, and thank you for sharing with us. We are now at the time that you can ask questions to both Dr. Walji, Dr. Tungare, and Dr. Law. Please place your questions in the chat or in the Q&A. So we have a first question here, maybe for Dr. Walji. How long is this study going for? How long should we continue to capture data with patients?
Yeah, thank you. That's a great question. As Dr. Tungare mentioned, we have about 500 patients to go, and we have a number of active practitioners. And so right now, I would encourage Dr. Bratt to continue recruiting, as many patients as possible, up to the maximum number that you have. And then basically what the node coordinators from each region are doing is they're advising their practitioners as to the total number of study participants that we need to complete on, I think, either a bi-weekly or monthly basis. So it's going to be, as soon as we get close to that threshold of 500, that's when we're going to notify the practitioner saying, we may need to stop quite soon. So right now, there's no limit. We don't have a definitive time frame, but we're expecting at our current rate, we could potentially end this study as early as February, March of next year. Our best case time frame is May when we want to end it, but it's possible to get it a little bit earlier.
We have another question here. Is there a way to compensate for or review changes in practitioners' anticipated patient pain as the study progressed and they were able to calibrate from prior data?
So Joanna, Dr. Cruz, could you rephrase that question? I'm not sure I understood it fully.
Yeah, maybe the person who asked the question could type it again, but what I'm understanding is there a way to review changes in practitioners' anticipated patient pain as the study progressed? Do you anticipate pain? Do practitioners reported what was the anticipated pain?
Yes, practitioners report on their day, the CRF, the case report form that you fill out on the day of procedure. You do provide your information on when do you think the patient will be out of pain, or when will be the most severe pain. So we do collect that, and then as part of the study, we are actually interested in comparing that with the patient-reported pain as well. We haven't done that analysis yet, but that will definitely be done, once all of the study data is being collected.
Mm-hmm. And the expanding on her question, she noticed that she changed her response for anticipated pain as higher at first, but then I saw my early patients were feeling better. So she started to recalibrate. So it's from experience. Yes. Dr. Himley is mentioning that the fact that measuring pain, right, and asking that question may have educated them on the expectations for later patients.
Yeah, no, thank you. That's actually a great point, and a point that I don't think we thought about and that would be happening. So we can definitely add that in the model as well to see, did the practitioners potentially recalibrate? So thank you for bringing that up. That's a great point.
Oh, there is Dr. Cole is asking here, what is the preliminary data on long-term local anesthetic with regular local anesthetic? That's another question that you have there. And I think there is the hypothesis that long-lasting anesthetics may decrease pain after the procedure that continue the effect. So they may need less pain medications later. Have you looked at the data, Dr. Walji?
I'm going to defer to Dr. Tungare on that one.
Okay,
So,
Dr.
yeah, we did say, at least in our preliminary analysis, about 40% of the times a long-acting anesthetic agent was used for the procedures. I'll also say that as preliminary analysis, we did not see any association between the kind of anesthetic used and the pain experienced post-operatively. But again, this is just preliminary and partial data.
That's a very interesting finding. I'm looking forward to the final results on that. There is another question here. Do we have a provision to include patients with a 2-visit procedure? I think maybe this is a protocol questions where patients were coming for procedures done in 2 visits. Were they allowed to enroll patients into the study?
Yeah, good question. And I'm looking towards Dr. Tungare. Do you remember? Did we have any cases like that, or did we specify in the protocol?
Yeah, we so because post-operative pain journey starts when the patient is first enrolled, and when the majority chunk of the procedure is done, that may affect the pain. So it is usually considered to be only one appointment that we take into account, and the procedure that is done on that day. Yeah, so we don't have a provision for multi-visit procedures yet.
That's an interesting point. I'll just add that there are some 2-visit endodontic treatments where the second visit might occur before the 21st day, and that if there was a way to capture that data, that might influence how we interpret if there was a spike in pain at a later time point, was it related to a second appointment?
Mm-hmm. We have one more question, and the question is, why was this study limited to extractions and root canal procedures? Why not include restorative dentistry, perio, and prosthodontics? Dr. Tungare, I know you can answer this question because I assume that all procedures were allowed, more procedures than just what you reported, correct?
Right. So a few of the graphs only included just specific procedure categories, but as far as the question goes about restorative procedures and other procedures, I believe that we did not include those because we also wanted to just select those procedures that were associated with a significant amount of post-operative pain in this study. Dr. Walji, you can.
Yes. That's correct. And so, when we originally designed the study, it was based on some literature that we had looked up, the types of procedures that seem to have more pain associated with them. So rather than recruiting a whole diverse group of patients where the pain might be very low, we try to focus on those procedures where we expected the pain to be a little bit higher. And we do have perio procedures included as part of it, but we did exclude the restorative ones.
Another question, did you see a reduction in opioid prescriptions? Again,
we're not there yet to completely say did we notice a reduction as we progress through time. But as far as the medications that were prescribed, we haven't looked into those. We so far have looked only into those medications that were reported to be taken by the patient. So that is the analysis that we've done so far. And we are just looking at medications and their impact on pain. As of now, we haven't looked for, as we go through the study period, whether prescribing changed or were there any trends in prescribing of different medications. So we haven't looked into that yet.
But I'll just add that that's a really great question, because one of the things that, in future work we really want to study potentially with an application like this is if practitioners do get a sense of their patient's pain level, they are able to get that data. Can that change their decision to prescribe an opioid even to begin with at the very start? Could that decision be delayed a little bit once you know the pain trajectory? So we're really interested in that. And as Dr. Tungare mentioned, we have data on what's being prescribed by the dentist, but then also what is being taken as reported by the patient as well. And it'll be very interesting to compare the amount of opioid prescribing, which just anecdotally seems to be, lesser and lesser, even from our own data, with what's out there in the literature. So hopefully we'll be able to provide some of that perspective as well.
See if we have any more questions. If you would like to ask a question, you can also raise your hands or type in the Q&A. Are there any other study questions that you are looking forward to explore, Dr. Walji?
Yeah, I think there's many. And so one of the things that we've been doing for the practitioners who have completed, many of them we've done some post-study interviews. And one of the questions that we asked them is, what would you like to learn, from your perspective about this? And, we've had various really great questions come up regarding, the patient's pain level based on, rural versus urban or other types of characteristics, where I think practitioners have a sense of, what's happening with their patients, and can that be seen from the data. So if anybody listening has any specific research questions that you're interested in exploring, please let us know, because we've got this very rich data set, and would love to be able to, work with you to try and answer those questions.
It seems very easy to recruit patients from a perio office. What else can we do? There is a practitioner asking that question. Continue doing the great work of enrolling patients.
Yeah, so absolutely. I mean, I think, as Dr. Tungare showed, perio procedures are a little bit less than we had for extractions and endodontic procedures. And, in hindsight, probably if we were to redo the study, we may have tried to be a little bit more focused and targeted to make sure that we were getting different disciplines involved from the very beginning. So that's probably a lesson that we've learned from the study team. But yeah, no, we'd love to work with periodontists or for those of you who do perio procedures more and more.
Yeah, and just emphasizing that practitioner is really interested in the difference between the expectations and what actually happens once the patient leaves the office in terms of pain level. And there is another question here is, will providers be interviewed after they study? Yes,
we are interviewing a subset of providers. There's I think we are 151 providers. I think our target is to interview about 45 providers, so about a third of the providers, that we select for interviews, just to kind of give us the flavor of, how the study went. If you are interested in being interviewed, please let us know. Once the study is completed, the node coordinator will normally reach out to you to determine your interest in being interviewed. So we really appreciate your feedback and time for that.
And Dr. Walji, we know that many practitioners have reached 30 patients or the limit 20 to 30, between 20 and 30 patients, but they are willing to enroll more patients. are they allowed, or we?
Yeah, no, we're very thankful, especially for those of you who were able to enroll the 30 patients. For now, we'd ask you to just stop at the 30 patients, mainly so that we can give the other practitioners a chance of also recruiting, from these other practices. Like we said, we've only got about 500 patients to go, and we have quite a number of active practitioners out there who have, just recently started or are midway through. So we'd like to give them the opportunity to also recruit patients.
I would like to have some final comments from Dr. Walji, Dr. Tungare, and Dr. Law. Mohammed, it's with you.
Yeah, no, thank you. First of all, as I mentioned earlier, I'm really, amazed with how well the study has gone. All credit due to the organization at the National Dental PBRN. It's the first time our study team has been conducted, an observational study like this through the network. And it's just incredible. Normally, we do studies with large organizations like academic institutions. And it's the type of data that we get is definitely much richer than we would get from just a single institution. So it's really a great vehicle to conduct research, and I've really come to appreciate the network and all of the practitioners who make this network tick to make it possible. So just my sincere thanks to you, and we really don't want this study to kind of the communication to end once we've collected the data. We're really hoping to feed this information back to you, and then for you to also give us ideas and other questions that you may have, after receiving this information. So thank you.
Dr. Tungare?
I completely echo what Dr. Walji has said. The support has been tremendous by NDPBRN and all the practitioners that we have in the study, and we are seeing such rich data that has been collected, a lot of information in there, and we just hope that we'll make the best use of it and be able to communicate it back to you, and that will help inform your practice better. So that's the goal, and like Dr. Walji said, we will be in communication. It will not just be end of participation in this study. Thank you.
Dr. Law, as a practitioner, would you have some final words for us?
Yes, and thank you for asking me. I think we undervalue the type of information we can get that is so clinically applicable from these studies. So I'm fascinated to see even the preliminary data and where we can go with this. I think we also don't appreciate how our dental assistants and hygienists and other team members appreciate being involved in research. This is something that many of them never thought they'd be able to do. And I was surprised at how engaged my team became in the study. Granted, they were getting some compensation for it, but even before they knew about the compensation, they were interested in helping patients and furthering the research. So that was exciting for me to see. And I think that's why this study has been so successful with so many practitioners.
Thank you, Dr. Law. You can move the slides, please. So I would like to thank all of you that attended the webinar today. It's very exciting to see preliminary data and also to hear the experience of a practitioner that did this study and be able also to answer all your questions about those preliminary data and the experience of doing this study. We are funded by the NIH. Those are the funding grants that supports this study, the network in general, and then specifically for the POP study. You can visit our website at nationaldentalpbrn.org. There is tons of information there and a blog with specific information about each study.